So good morning, everyone, and welcome to the Discovery Hub. So this is going to be your virtual work experience hub for today, where you can look at the various roles in the NHS and be part of some patient journeys, learn about the MDT, reflect on your own journey and have a look at some careers, not just university, but some apprenticeships as well later on. So without further ado, we'll kick off the day with Abi Changer and looking at some NHS health careers. Thank you very much.
Thank you, Jack, and good morning, everybody. It's quite bright and early, isn't it, for a Saturday morning, but I'm really pleased to be here and be able to speak to you. So hopefully my talk will kind of set you up a little bit for the rest of the sessions on the day, because this is very much an overview of the range of roles in the NHS and also different routes in. So I hope you enjoy it, I hope you learn something, and I hope it gives you some resources so that you can go away, excuse me, and find out more. So I'm Abi, I'm the Careers Information and Quality Lead with the NHS Health Careers team for England. So yeah, as I said, really busting some myths hopefully as well. We've got 45 minutes, hopefully there'll be time for questions at the end. So please do put your, fire away with your questions and hopefully I'll be able to get those answered. But you've got a great day ahead, loads of really great sessions. So one of the myths that we kind of have to bust a bit is the fact that the NHS is not just doctors and nurses, that there are so many other roles. And in fact, there are over 350 different roles in the NHS. So there really is something for everyone. You don't have to have a degree to work in the NHS. You don't have to do a patient caring role. There are some roles that are very much behind the scenes, you know, either in a laboratory or in an office. The range is really, really huge. So I'm just going to do a little bit of background and context, talk about some of the careers that are available, talk about how you get into them, about some of the financial support as well, and some resources from the NHS Health Careers team, and also mention how to use the NHS Jobs website, which is a really, really useful resource. So just to get started with a little bit of background and context, although the NHS is an umbrella organisation, there are then lots and lots of different employing organisations underneath that umbrella. So you will see variation between NHS Trust and NHS Trust, for example, in terms of the types of apprenticeships on offer, the sorts of training positions there might be, the sorts of work experience or volunteering opportunities there might be, and the types of vacancies. So it's just something for you to be aware of. Okay, so the NHS is one of the world's biggest employers. It's about the 5th biggest employer in the world, biggest in Europe, and then, so of course, biggest in the UK, with about 1.7 million people working for it, if you take into account Wales, Scotland, and Northern Ireland. So a massive organisation, and they're really, I'm now about 25 years into my career in the NHS, and there really is that feeling of belonging to something that the nation is proud of, and you know, a huge organisation that at the heart of it seeks to make a difference to people's lives. And that's the same for every single role within the NHS, whether you are hands-on patient caring or whether you are behind the scenes, you're making a difference to people's lives. Okay, so definitely not just doctors and nurses, and hopefully you've got that message already. But there really are many, many different roles, and we group them broadly under these groupings here. So we've got the allied health professionals, and I know there are a lot of sessions about AHPs, as we call them today. So this includes roles such as radiographers, speech and language therapists, podiatrists, and many, many others. The ambulance service team, so not just paramedics, but you've got your call handlers as well, emergency care assistants, etc. The dental team, again, not just dentists, but dental hygienists, dental nurses, technicians as well. And then doctors with the 60 plus different specialties, all with their slightly different training routes. Health informatics, this is a really growing area. So we know that we need people who are very skilled at collating and analysing and reporting on data. So at the end of the day, that improves patient care. So we need those people who are really into technology, informatics, manipulation of data. Healthcare science. So I think, you know, during the pandemic, we've really seen some of what healthcare scientists do, and there are some amazing roles out there. Some of them very, very patient facing, involved in diagnosis and treatment, others much more behind the scenes, so laboratory based, but each one of them making a difference. Management, so we've got financial management, HR, estates and facilities. Again, you know, all sorts of different types of management within the same organisation. The medical associate professions, this is a small group of staff, and the main one that I'm just going to highlight for you today is the physician associate. So it's a role you might have heard of. It works as part of the medical team. It's trained in the same model as doctors, and it's on the whole a postgraduate training programme, but we do have 2 undergraduate training programmes in England now as well. So one at UCAN and one at the University of Reading. Midwifery then, and then nursing with its 4 different fields. So adult, mental health, children's and learning disability nursing, each with a massive range of opportunities to progress and specialise. Pharmacy, again, not just pharmacists, but pharmacy technicians and assistants as well, and different areas of the health service that pharmacists can work in. And another really growing area is the psychological professions. So not only in terms of numbers that we have working in the psychological professions, but also there have been several new roles over the last couple of years as well. Again, working in different areas, so some based in community, going to people's homes, schools, or working within hospital settings. And the public health team, again, they've been really, really busy over the last 16 months or so. So if you've got that interest in science, in how people behave, in trying to understand how we can best protect our wider community health and prevent disease as well, then some really interesting roles there. And then last but definitely not least, the wider healthcare team, loads of different roles in here, from clinical support worker roles, healthcare support workers, estates and maintenance people, porters, domestics, catering staff, and many, many others. So just to give you a few ideas then, if you haven't quite decided what it is that you want to do, but you know you want to work in the NHS, perhaps you're a very practical person and you want to use your hands and practical skills in your roles. So I won't read each of these out, but just to give you a few ideas of some of the roles that you might want to look into there. Anything from drama therapist, dental technologist, orthotist, gardener, etc. Or perhaps you'd really like to work with children, and you know the only option is not children's nursing. There are many, many other roles where you can work with children. So whether that be in terms of mental health support, or such as something like drama therapist, for example, or child psychotherapist, or a newborn hearing screener, or maternity support worker, and many, many other options. Or maybe science is your thing, and I'm sure many of you who've joined today are in this category. So you really enjoy science, and you're interested in how the body works and how machinery works, and you want to use that knowledge and that passion in order to improve patient lives and make a difference to people's lives. And many options to do that there. Dietitian, physiotherapist, pathologist, phlebotomist, pharmacist, and many, many others. So that's just to give you a few little ideas to kind of get your mind thinking about where you might end up. Okay, so as well as a wide range of roles and of groupings of roles and of different settings in terms of where you might work, there are also many different entry points. So wherever you are in your career, whether you are a school leaver right now, or coming up to the end of college, or you're a graduate, or you are a career switcher, someone later on in life who's been working in a different sector and wants to get into health, there will be an entry point for you. And also, no matter what qualification level you've got. So we have roles in the NHS where even if you don't have your maths and English GCSE, you can be supported as part of your job or your apprenticeship to gain that qualification. There are some roles where we need you to have postgraduate training, and then there is everything in between. So wherever you are in that journey, whatever your academic ability, there will be a role for you and there will be an entry point for you. Okay, I just want to give you a little bit of an idea of some of the apprenticeship vacancies that we've had in the NHS over the past 3 months. So this is a tiny snapshot. There are loads of apprenticeships advertised every day in the NHS. You find them on the NHS Jobs website, which is jobs.nhs.uk. You should also find them on the government Find an Apprenticeship website, but I would check that you check both just in case. I would advise you check both. So this is just to give you an idea. So we've got registered nurse degree apprenticeship. So that's a degree level apprenticeship. You come out with exactly the same qualification as if you had gone to university and done a full-time degree. Apprentice podiatrist, so another degree level apprenticeship there. Payroll administration apprentice, So if you're into finance, then that might be an apprenticeship you might want to look into. Healthcare science assistant, trainee nursing associate. So that nursing associate role sits somewhere between healthcare support worker and registered nurse. And it's a 2-year level 5 apprenticeship, so equivalent to a foundation degree. Apprentice radiotherapy engineer, biomedical scientist, data analyst, psychological wellbeing practitioner, and physiotherapist. So you can see and that, as I said, again, I can't emphasize enough, that's just a small selection of some of the adverts that have been live over the last few weeks. So do have a look at NHS jobs, and you might be surprised what you come across there. Okay, then we've got several degree level apprenticeships in the NHS that have been approved for delivery. Excuse me a second. So the thing to point out is just because they've been approved for delivery doesn't yet mean that we are seeing lots of vacancies. So it's a case of keeping watch, because the ones that have been around for a little bit longer, so for example, registered nurse, initially there were very, very few vacancies for the registered nurse degree level apprenticeship, but we are seeing more and more now. And the same thing will happen with the other degree level apprenticeships. Excuse me, that you can see on here. And the other thing to bear in mind as well is that if you really want to do an apprenticeship to get your degree and to get your professional qualification, but you can't see any vacancies yet, think about getting an entry-level position. So for example, if you want to be a physiotherapist and you're really desperate to do that via an apprenticeship for whatever reason, then but you can't find any vacancies right now near to where you live, think about getting a role as, for example, a therapy support worker in your local NHS trust, and then talk to your line manager, talk to the training and development department or the apprenticeship lead, talk about the opportunities there might be, because it might be that you then can move on at some point in the future to that physiotherapist degree apprenticeship. And you've already then you're gaining experience, and that's going to strengthen your application and your success in that apprenticeship. Okay, just a couple of example pathways for you here. So for example, to become a paramedic by doing apprenticeships, you could do an ambulance support worker level 3 apprenticeship, move on to the associate ambulance practitioner level 4 apprenticeship, and then onto the paramedic degree apprenticeship. To become a therapeutic radiographer, you could become do your healthcare support worker level 2 apprenticeship, then move on to assistant practitioner level 5 apprenticeship, and then the degree level therapeutic radiographer apprenticeship. So just a couple of examples there to give you an idea of how that progression might work if that's the sort of route that you want to take. I just want to very quickly run through some of the different routes that you might get into nursing in England. So several different ways to do it here. We're not going to talk through all of these in detail because I'm very aware of time and I really want to make sure that we have time for questions at the end. But you might, for example, maybe somebody who's got GCSEs, grades 4 to 9, and then is able to access the 2-year nursing associate apprenticeship, and then move on to a shortened registered nursing degree apprenticeship. Because if you've already got a level 5 apprenticeship as a nursing associate or what's called an assistant practitioner, there might be an opportunity with an NHS employer to do a shortened, what's called top-up registered nurse degree apprenticeship, which would just take another 2 years. And at the end of that, you would be a registered nurse with the Nursing and Midwifery Council. So the next one along, Helen there, that's the more traditional kind of route. So A-levels and then off to university to do your 3-year degree in nursing. And we've got Kamara, first degree in psychology, and then decides that she wants to do nursing. So she's able to do a shortened, so an accelerated course in nursing because she's already got a first degree. Then Chantel, GCSEs in Maths and English, working as a healthcare assistant, is able to complete the level 3 senior healthcare support worker apprenticeship and then move on to the nursing degree apprenticeship, which is the sort of thing I mentioned in the previous slide. Okay, or we've got Rob, 25, with GCSE Maths and English. He hasn't got level 3 qualifications, so does an access to higher education course in nursing and is then able to move on to the nursing degree apprenticeship. Josh with a B-Tech Extended Diploma in Health and Social Care, then goes off to university to do his nursing degree. Then we've got Jamil, so another one here who's got a first degree in another subject and then goes to do the accelerated course. And then finally, Kiara, no Maths and English GCSEs at 4 to 9, but is able to get a place on the level 2 healthcare support worker apprenticeship, during which she's supported to get her equivalent of maths and English GCSEs, and then she progresses up through the apprenticeships that way. So lots and lots of different options, as you can see. Okay, so I wanted to talk about financial support. So we have got something called the NHS Learning Support Fund. And this was expanded from September 2020. So if you are studying nursing or midwifery or many of the allied health profession courses, then you will be eligible for £5,000 a year training grant. That doesn't have to be repaid. It's not a loan, it's a grant. So it's yours to use to help with your living costs. Now, there are also some added bits to that learning support fund. So there's £2,000 parental support if you have children. If you are studying mental health nursing, learning disability nursing, radiography, podiatry, orthoptics, prosthetics and orthotics, then you will get another £1,000 a year as a specialist subject payment, because those are shortage professions. And if you're having to travel any distance for your clinical placements, because all of these courses will have a clinical placement element where you get that hands-on experience, then there is some help towards travel and accommodation costs. So this isn't for the degree apprenticeships that I was just talking about, because for a degree apprenticeship, you get paid a salary. But this is for if you are going to university and studying a pre-registration course in one of these. It's all administered by the NHS Business Services Authority. So if you go to their website, you'll find out all the details there. In terms of student finance then from the Student Loans Company, healthcare is a little bit different from other subjects, because if you've got a first degree, so those examples I gave just now, so we had someone who had a first degree in biology and then went and did an accelerated nursing degree, you would still get the learning support fund, so that training grant I mentioned, and you are also eligible for another lot of student finance. That is, it's an exception for healthcare courses. Now, the only one that's a bit different is if you're studying paramedicine and you've already got a degree. Unfortunately, you wouldn't then be able to get a second round of student finance, but you are still eligible for the training grant from the NHS Learning Support Fund. And you can find out all the information on the government student finance website. Right, values-based recruitment. This is absolutely vital. When you are applying for a job in the NHS or in health, or applying for a course, whether that be at university or college that's related to health, the admissions tutors and the employers are going to be looking to make sure that not only do you have the right qualifications and experience that they're looking for, but very importantly, they're going to be looking to see whether you hold the values that are in line with the NHS Constitution. So these 6 values here are all taken from the NHS Constitution, and you really need to think very carefully about how you can evidence that you live these values so that you understand them and you've got examples from your life. So it doesn't matter where you are drawing those examples from. It might be that you're drawing them from your home or family life, or from school or college life, or from sport, or from volunteering, or a Saturday job, or from some work experience. It really doesn't matter. The important thing is that you can relate your experiences to evidence these values, because you might well get asked about these at interview, and you also might want to think about how you can incorporate these into your supporting information, your a personal statement, etc. So really, really important. So spend some time after today, once you've had time to kind of digest everything, spend some time really thinking about examples of these values from your life, because these are absolutely crucial, because we've got to have the right sort of people working in the NHS. It's, you know, you might have 4 A stars in your A levels, but you have to hold these values as well. Okay, so really, really important message there. Okay, so work experience, and I know this Discover Hub, there'll be lots of sessions after this, probably with much more detail about work experience, but I just want to touch on it really, just to start talking about it for the day. So it obviously, the last 16 or so months has been really, really tricky. It's not necessarily easy to get work experience in healthcare anyway, but obviously the pandemic has pretty much put a stop to any face-to-face work experience. Don't panic, all right, because employers and course admission tutors know what it's been like. So many universities and certainly employers are being much more flexible about their requirements. So that's where those values are really important. As I was talking about, think about the different areas of life you can draw those experiences from. And think very broadly, okay? It doesn't necessarily have to be work experience based in a hospital. Think about care homes, think about charities, think about, maybe you've helped out an elderly neighbour during the pandemic with their shopping or whatever. And look online. There are a lot more online kind of work-related learning or insight opportunities starting up now. So platforms like SpringPod. There is, if you're interested in doing medicine, there's one called Observe GP, which is very popular. Brighton and Sussex Medical School have a scheme as well. So get online and get Googling and see what you can find, because there are various opportunities out there for it's not work experience as such, but it's work-related learning, or it's giving you an insight into it. Talk to people, maybe you've got family or family friends who do jobs within the NHS. Talk to them, find out from them, find out what they do in their day-to-day life, find out what their training route has been, find out what they like about their job, what they're not so keen on about their job, what the real challenges are, because all of that will help you build a picture and will make you much more informed if you're going for an interview or applying for a job or a course. So just think as broadly as you can, and as I say, start to build that base of evidence. Okay, so the Health Careers website, some of you may have seen this already. So this is the NHS Health Careers website, so a real one-stop shop for all that information about NHS Health Careers. So the web address is healthcareers.nhs.uk. And you'll find tons of information on here. So after today, you might want to go away and have a really good look through the website. So the tabs along the top there. So we've got working in health. That's got lots of sort of generic and general information about working in health. The next tab along, Take Our Career Quiz, I'll talk about in a minute. That's a really popular tool that we've got on the website. Under the Explore Roles tab, this is where you'll find the individual pages of information about the different roles. So if you are particularly interested in, for example, Biomedical Scientist, you'll find a page of information. It'll tell you more about what you would do in your day-to-day work. It'll tell you about the training routes. It'll tell you about the progression opportunities. And there's quite often a real life story of someone talking about how they got into it, what they do, what they enjoy about it, etc. So lots of information under that Explore Roles tab. The career planning tab I'll mention in a minute as well. The We Are the NHS tab, this has got some 3 specific tabs under the drop-down menu there, one for nursing, one for allied health professions, and one for healthcare support workers. And there's a really short registration form there that you can sign up to receive emails giving you more information about those particular groupings of staff. So if you're particularly interested in those, I do recommend you sign up and you can receive more information. You can also register on the account on the website for other information as well in other areas of work, and that's at the top right there. So you might want to have a look into that. These are the, sorry, I've forgotten I got this slide on here. So these are the little tiny registration forms I mentioned for the specific careers. So I've just screenshotted the allied health professional careers one there. So when you go on to We Are the NHS, that drop down will come up. And as you can see, it's a really, that's the entirety of the registration form there. So you literally just put your name, email address, whether you're currently in school or sixth form or wanting to switch careers, and then which particular roles you're interested in, and that is it. So really encourage you to sign up for that information there. Okay, the Find Your Health Career tool that I mentioned. So this is under the Take Our Career Quiz tab. So if you're joining this today and you are not quite sure what role you might be interested in, but you know you are interested in health, have a go at this health career tool. So it's a series of statements, and depending on how you respond to those statements, it'll then bring up some suggested roles at the end that you can click into and find out more. So it'll be based on your interests and your skills. Now, you might have joined today being absolutely sure that you know what role you want to do. I'd still recommend you do this because it's good to have a plan B up your sleeve. So have a go at the Career Finder tool and see what it comes up with. We've got a Course Finder tool as well, and this is under the Career Planning tab. Now, the reason we have this is because when you search on UCAS for particular courses, it can sometimes be difficult to root out which courses actually lead to professional registration as that particular healthcare professional. And obviously that's really important at the end of the day to be able to work as, for example, I'll use physician associate, because that's up on the screen there as an example. You need to be doing a course that you know is going to lead to you being able to get a job as a physician associate. If you want to work as a nurse, you have to do a degree course that has been validated by the Nursing and Midwifery Council in order to become registered as a registered nurse at the end of it. So our course finder pulls together all those courses, and you can search by the career you're interested in, you can search by region, you can search by type of qualification. So if you've already got a degree and you're looking for an accelerated course, then you can use that drop down filter there to search. Once you've got your list of courses, you can then click through to the university website, and that'll show you what the entry requirements are. As you've probably already discovered, entry requirements can really vary between university to university. So it's really important to check the different university websites and see what they're asking for. So that's the course finder tool, again, a really popular one on the website. Okay, we've got to step into the NHS website as well. So if you're joining us today and you're in Key Stage 3 or 4, you might want to have a look at this. A little bit more bite-sized kind of information on some of the roles, and another career mapper type quiz as well that you might want to have a look at. Right, the NHS Jobs website, I've mentioned this briefly already, but I just want to come back to it because it's a really useful resource for you. Because for a start, it gives you a bit of an idea of how many of the particular jobs that you're interested in, how many are advertised at any one time. You can also find out what those employers are looking for. So once you find a vacancy you're interested in, find the person specification. It's usually down the right-hand side. When you click on the person specification, that will show you what the employer is asking for, both in terms of qualifications and experience. So the person specification is really important. You can register with NHS Jobs. So let's say you want to find a nursing associate apprenticeship. They're often advertised as trainee nursing associates. You can register with NHS Jobs. Then you can search for trainee nursing associate, and then you can save that search and set up an email alert so that you receive an email when a trainee nursing associate vacancy comes up. And you might want to use different keywords, because going back to that point I made about different organisations having slightly different kind of opportunities, they might also call the same job slightly different job titles, which can make it tricky when you're searching on NHS Jobs. So try different sort of search terms out and see what you come up with. You can search by postcode as well, or by salary, all sorts of different ways of cutting it. There's a section for advice for job seekers in the middle there, so hints on applications and interviews and that kind of thing. Now, the other thing just to mention is that when there is a job advert on NHS Jobs, there will be a named contact with that advert. So if you see an apprenticeship, for example, that you're interested in, and you're not quite sure if you meet the person specification or not, get in touch with that named contact. That's what it's there for. Have an informal chat with them, ask them questions, tell them about your experience, your qualifications, and they'll be able to tell you a bit more and give you some advice. So do use those named contacts. If you're wanting to find out from your local NHS trust, maybe you're really keen to become a podiatrist and you want to do that via an apprenticeship, get in touch with your local NHS organisations. Find out if they've got those sorts of opportunities coming up. So there's a directory of employers on the NHS Jobs website under the Browse Jobs tab, and you can find the contact details there for local NHS organisations local to you. Try and get hold of the apprenticeship lead or the training and development department or the HR department and ask those questions about, what opportunities they might have coming up. It might turn out to be an incredibly useful conversation, and you might find out, sort of in advance what might be coming up. Okay, so please do have a look at our website. Oh, apologies for the visit our stand there. That shouldn't be on there. We don't actually have a stand here today. Do have a look at our website. So healthcareers.nhs.uk is the one that I've talked about the most. follow us on social media. If you've got, we'll try and get through to the questions in a minute if I can see a few have come in. But if after today you think of questions that you've got about NHS health careers that you wish you'd asked today, we've got a contact centre. So you can either email them advice@healthcareers.nhs.uk, or you can call them 0345 6060 655. And there's also a contact us form on the website as well, on the Health Careers website. So do get in touch and you can have a chat to one of the members of the team at our Health Careers contact centre. So I really hope that's been useful to you, as I say, kind of giving you a bit of an overview and setting you up for the day. I'm just going to go through the questions here, but if there's anything I haven't talked about that you were hoping I was going to talk about, we've still got 15 minutes. So do let me know just by popping something in the chat box now, but I'm just going to have a look to see, or it looks like there are a little bit of technical issues for a couple of people, but hopefully that got sorted. Alexander, so you've asked about apprenticeships for medicine, vet and dentistry courses. So I can't comment on vet because that doesn't fall under the NHS, but there are now discussions going on to develop an apprenticeship to become a doctor. So it won't be for at least another year or so, but that particular apprenticeship standard is in development. So it's likely to be a 5-year master's level apprenticeship, and that is being developed right now. So keep an eye out. At the moment, that's not happening for dentistry, not to become a dentist anyway. There are apprenticeships in other members, so you can become a dental nurse by doing an apprenticeship, but not yet for becoming a dentist. But who knows, potentially down the line that might happen. So I hope that helps, and thank you for your question. Amina, you've asked about the training grant. Is it given month by month? I believe it's given termly, Amina, so I believe you'll get it in 3 instalments over the academic year. Bethany, do you have any sources for information on NHS careers on the development side of medicine in labs? Okay, so this tends to happen, Bethany, outside the NHS, that more the development of medicine side of things, so more in the kind of the pharmaceutical industry. So you might want to have a look there. Right. Julia, and apologies if I haven't pronounced your name correctly. How useful is a university degree in comparison to an apprenticeship? So this really is personal preference, because let's use nursing as an example. If you go to university and you do your nursing degree full-time at university, or and you get your Bachelor of Science in Nursing and you get registered as a nurse with the Nursing and Midwifery Council, or you do an apprenticeship, registered nurse degree apprenticeship, and you end up with exactly the same qualification, with exactly the same professional registration. You've just gone about it in a different way. So you are getting that hands-on work experience from day one with the apprenticeship. You are getting paid a salary, versus going to university where you're getting that kind of university experience, but you are having to fund it. So it really depends. It depends on your learning style. It depends on your preference, on your situation, your financial situation, but the end qualification is the same. Okay, so I want to reassure you there, it is the same quality of qualification that you end up with. So I hope that's answered your question. Okay, right, Trisha, how can you get into nursing after studying a B-Tech Diploma? Okay, so Trisha, it depends what level B-Tech Diploma you're studying. If it's a level 3 B-Tech Diploma, then you can use that then to move on to a degree level course in nursing. If it's not a level 3 program, you might need to do something either at level 3, or you might go straight to a level 5 qualification, for example, like a nursing associate role, and then do your nursing degree qualification after that. So several different ways to get there. So Trisha, what you might want to do is have a look on our Health Careers website, sign up for that nursing information, and that will tell you more about that. So I hope that helps, Trisha, but do let me know in the chat if you've got a more specific question as well. Julia, does medical research fall under the medicine umbrella? So there are research jobs within the NHS, definitely, but there is also a difference between what's kind of done in industry and what's done within the NHS. So some people, for example, work part of the time in the NHS, part of the time with a university doing research. So absolutely, there are medical research jobs. If you go into medicine, there will be opportunities for you to go into research or academia as you progress through your career. Okay, Ella, if you have a degree in medicine, can you access almost all healthcare jobs, for example, physiotherapist, or would you have to do a physiotherapy degree? Yes, you would, Ella. So it's a totally different way of training. It's a different focus in the job, and it's a different regulatory body. So if you're a doctor, you are registered with the General Medical Council. If, for example, you're a physiotherapist, you're registered with the Health and Care Professions Council, the HCPC. So you have to have a qualification that meets a physiotherapy qualification that meets the standards of the HCPC to become a physiotherapist. But if you had a degree in medicine and did want to then become a physiotherapist, you're likely to be able to access a shortened training program to become a physiotherapist. You are unlikely to need to do the full 3-year program. So I hope that makes sense. As I say, come back in the chat box if you've got another question, but it's a good question. Thank you. Okay, Jessica, do you need work experience to become a midwife, or can my A-levels get me to university alone? Okay, so you ideally need a bit of work experience, or certainly to be able to demonstrate an understanding. It might be that you do some volunteering, Jessica. And as I said, at the minute, universities are being much more flexible about what they're looking for. So you might want, if there's a particular university or universities you're interested in, get in touch with them and ask them what they are looking for. But A-levels, that's great, and that's the level qualification that you need. But you increase your chances of success in getting a place if you've got, if you have got some experience, or if you are really able to talk about those values, talk about how you demonstrate them, talk about how you live them in your everyday life. So yeah, I hope that helps. But don't worry, if you can't get experience actually working alongside a midwife, that's not going to be make or break, because universities understand that that's really difficult to get hold of. So it comes back to my point about thinking really broadly about the sort of experiences that might help you gain an understanding of the job. Okay, Umama, what path would we have to follow if I want to specialise in gynecology and obstetrics, and how long will it take? Okay, so if you're talking about becoming a doctor and specialising in obs and gynae, Umama, so you've got your usually 5 years at medical school, followed by 2 years on what's called a foundation training programme, where you move around different specialties. And then towards the end of that, you select and you apply for the specialty that you would like to train in. So ultimately, that's the specialty that you want to become a consultant in. So that would be, for you would apply for obs and gynae, specialty training pathway. I can't remember how long that is. I think it's about 5 years. So that's the pathway. But if you're not talking about medicine, you might be talking about becoming a nurse. You can become a nurse and specialise in obs and gynae as well. You become a physiotherapist and specialise in obs and gynae. And you would do that by working within that area and developing your knowledge and your experience. So I hope that's answered your question. But as I said, come back in the chat if you've got more. Okay, so Julia, what kind of A-levels are considered for a medicine degree? So this is where it's a good idea to have a look at the universities, because they will have slightly different requirements. A lot of medical schools do want chemistry A-level, and some of them then a second science, but some are a little bit more flexible. So do have a look and see what those universities are asking for, okay? Right, Amina, if you've done a degree already, i.e. nursing, but then want to do medicine, would you still have to do the full 5 years of medicine degree? At the moment, Amina, yes, you do. There are, there is a graduate entry medicine programme, but it's still 4 years. And nursing would probably be considered a suitable one. But again, different universities have different requirements, but there are some universities that offer the 4-year graduate entry medicine programme, and nursing might well be one of those relevant degrees that they would consider for that 4-year programme. But it is still 4 years. Trisha, nursing degrees, so usually 3 years at university. On the whole, the degree level registered nurse degree apprenticeships are 4 years, but obviously you're getting paid while you're doing it. So, things up. what kind of jobs can you do with a medicine degree? So that's where you would go onto your doctor training pathway to specialise in the particular area of medicine that you wanted to progress into. Okay, Jessica, what degree could I get if I wanted to do neonatal nursing? So you could do your children's nursing degree, for example, Tricia, or yeah, that would be one of the main ones, or potentially adult nursing and then get some experience working in paediatrics. But children's nursing would be the most obvious route to get into that. Amina, after the 5 years in medical school, when you do the foundation training, is that paid? Yes, it is. Yeah. So you have a job at that point. You are called you're still called a trainee doctor, but you're in a job and you're paid for that. Absolutely. And Jack, so yeah, Jack, you've just asked the same thing. So yeah. So Amama, so if I do medicine for 5 years and do foundation training, can I still work as a doctor after med school or after the training? Oh, hold on, I'm just trying to work out that question. So 5 years medicine, then your foundation training. I think maybe you're asking, even if you don't do the specialist training, can you still work in medicine? And yes, you can. There are different jobs you can do as a doctor that are not part of a training program. I think that's what you're asking. I'm sorry if I've misunderstood. And Asma, you said, can you get into medicine with chemistry, maths and geography A levels? So Asma, that's absolutely a possibility, but check the entry requirements of the med schools, because, as I say, they all vary. So yeah, have a look and see. But potentially that sounds like a good mix. Tricia, can you take the midwifery route to neonatal nursing? Quite probably, Tricia, that could quite possibly be an opening for it as well. What I'd suggest you do, get onto NHS Jobs, search for some neonatal nursing jobs and see what they're requiring, because it might be that they say registered nurse or midwife. So have a look and see what they're asking for. Amama, what's the foundation training like? So I've not done it, Amama, because I'm a nurse by background, not a doctor, but you normally rotate around different areas, and you do you maybe move every 3 or 4 months or so, sometimes a bit longer. And so you get to try different things, but you are working. So you are a junior doctor, basically junior doctor in training during that foundation training. But you get to try out lots of different areas. So it's a really valuable experience. Oh, there's been some really great questions. Oh, thank you. Oh, one more. Tricia, how long's a midwifery degree? Usually 3 years, Tricia. That's the standard length, is 3 years. Amina, my specialty in nursing. So I used to work in post-operative care. So I used to look after people when they'd just had surgery done, and I would make sure they were safe as they were coming out of anaesthesia, make sure their observations were stable, deal with any immediate post-operative complications. And I loved it because there was a real variety, and we'd look after people after major heart surgery, or people who'd had minor surgery, and all ages as well. So it was a great job. I really enjoyed it. So we've got 2 more minutes, I think, before we'll get cut off. Really great questions. Thank you so much for all your questions, and I hope it's been a helpful session. Please do remember that we've got our Health Careers website with all that information on. Remember that we've got the Health Careers contact centre, and the details are up on the slide. Tricia, I love this, Tricia. You're sneaking in one more question. That's brilliant. Yes, you get paid for the full 4 years. Now, different employers will pay different amounts during apprenticeships, so you'd need to see what the advert said. But yes, you get paid for that full 4 years. You have no tuition fees. That's all taken care of by your employer. Well, brilliant. Thank you so much. Thank you for all the thank yous. I hope you all have a really good day. Enjoy the conference. Get as much out of it as you can. And you can use what you're learning today when you come to apply for courses and jobs as well. So, yeah, really enjoy it. And thank you so much for listening.